Hello, my name is Cindy Garza, and I'm the project coordinator with the Center for Nursing Research, Quality and Practice at Advocate Health.
And I'm Chris Weiner, chair of the Nursing Professional Development Council, and also a clinical ICU nurse at Aurora St. Luke's Medical Center in Milwaukee, Wisconsin. We are so excited to share with you our journey to rejuvenate the DAISY Award program within our organization after a pandemic.
Advocate and Aurora organizations cover the eastern side of their respective states from as far north as Marinette, Wisconsin, down to the south side of Chicago. We are 22,000 nurses strong who serve 27 hospitals and 500 sites of care. So let me explain shared governance within our organization. We have an overarching shared governance council, and at that table is 27 sites of shared governance chairs. And at the site level, our unit and department shared governance councils. This rejuvenation project was a goal of the Professional Development Council for 2022. All chairs align with a nursing leader for mentoring and support. This structure is a vehicle for clinical nurses to govern their practice to positively impact our people, the patients we serve, and the profession. Support of leadership at each level is very crucial.
The Professional Development Council assigned a work group to develop this SBAR. Although the integration between Aurora Health and Advocate Health was completed in 2018, the group determined there was no harmonization between the two systems when it came to recognition, other than the annual Nurse of the Year program. Everyone was doing their own thing, and the onset of the COVID pandemic in 2020 led us to the removal of all brochures and pamphlets within lobby settings. The strain on the clinical nurse was tremendous, which resulted in burnout, personnel changes within the workforce, and leadership readily acknowledged recognition is key to retention, but we didn't have anyone leading or owning it. The key nursing strategic initiative of nurses connecting to purpose through consistent and meaningful recognition has been a guiding light along this journey of the DAISY Rejuvenation Project. As you know, 2020 opened up the opportunity for innovation, for everyone, for everything. The Professional Development Council, along with a couple of very engaged DAISY coordinators, came up with the 5 work streams to rejuvenate the program within our organization. Our goal was to maintain the integrity of the DAISY Foundation's award program while aligning it with our internal nursing professional practice model, placing a focus on making it patient-centered, maintaining our organization's brand guidelines, and engaging 2 key elements of success, the DAISY coordinator and the clinical nurse.
Our current teammate recognition platform is referred to as Kudos Connection and is a platform developed by WorkStride. We utilize this platform for all internal recognition from daily thank yous, anniversary celebrations, and our annual award programs like Nurse of the Year and Living Green. In fact, we just surpassed 1 million recognitions since implementation in late 2020. Workday is our HR database and is interactive with Kudos. We worked with WorkStride to develop an external platform, patient-facing, if you will, that we use for DAISY online nominations. Because it is tied into Workday, we can ensure nominations are aligned to the correct nurse, make recognition of the nomination almost immediately, and download data by site, nurse, or even by department when it comes in handy for leaders looking for that data for their site that they may need to produce evidence for magnet. Also, because we are working within 2 platforms that tie well into each other, we are able to add nurse leader or nurse educator nominations in the future. Because we now host our own online portal, we offer 1 QR code and 1 vanity URL so that any patient that accesses a site of our care at any time from anywhere can put in a nomination for our nurses.
So how do we get those awe-inspiring nominations? We worked hard on maintaining the integrity of the DAISY Foundation's brochures while following our brand guidelines of lighter, easy-to-read type styles, and patient-focused. We started by taking our nursing guiding principles, otherwise known as the nursing professional practice model, and developed what we thought was criteria to guide the patient visitor in writing a nomination. But then we had a major aha moment. Our patients and visitors do not understand what our nursing professional practice model is, nor should they, as it is our internal practice code. It's what nursing practice excellence is and how nurses do it. But we needed to hear those stories about how clinical nurses aligned with the professional practice model and were translating it into patient care. So we created simple short bullet points to guide the patient in sharing their story, and then pulled in our plain language counsel to ensure that our patients could easily understand what we were asking of them. We took it one step further and ran it all past our patient and family advisory council to get their feedback. To maintain consistency, we have limited our sites to these 3 items to choose from. All are available on our print shop, where they can order in color or they can be downloaded and printed on site. We offer them in English and 6 other languages: Spanish, Russian, Hmong, Lao, Korean, and Polish. So what happens if we see another pandemic and all of our printed materials goes away? Another outside of the box idea was the creation of a dot phrase. A dot phrase is used in Epic, our electronic health record system, which allows a nurse to simply type in .daisy and this entire message pops up in the after visit summary. Anyone prepping the discharge papers can do this. The dot phrase includes both the vanity URL and a QR code. Now, we all know the awkwardness or the feeling of fishing for compliments, or the fear of adding more paper to go over with your patient that just wants to go home. Or maybe no signage is allowed in the room or area. This dot phrase can eliminate all that because it is part of the after visit summary. The nurse does not need to refer to it when reviewing discharge instructions, as it is self-explanatory, and the patient is still taking the information home with them. If the patient chooses to view their after visit summary digitally in their LiveWell account versus a printed after visit summary, the hyperlink translates as a live link and the patient can click on it to go directly to the online external portal.
Both of our organizations, Advocate Health and Aurora Health, have their own websites, and we've included a specific Recognize a Nurse page with a hyperlink that goes directly to that online portal. In addition, our organization utilizes the LiveWell app, a mobile phone app allowing patients to manage their health care. They can now also nominate a nurse. We are built within the menu and listed under resources.
So how does this online recognition portal work? The nominator follows 4 simple prompts. The online nomination is the brochure, only on a digital device screen. We gather as much information as possible so the DAISY coordinator can align the DAISY nomination with the correct nurse. Once the nomination is submitted, it is held until the DAISY coordinator can align or link it to the correct nurse. When the nomination is aligned or linked, an automatic email is sent to the nominee and their one-up stating they were nominated for the DAISY award. The DAISY coordinator preps a report removing patient identifiers of all the nominations for their site to give to the DAISY Honoree Selection Committee, which is attached to the site's nursing share governance and is clinical nurse led. The selection committee scores the DAISY nomination against the rubric, and once the honoree is selected and celebrated in DAISY fashion, the DAISY coordinator confirms the award and the honoree receives a digital DAISY badge in their kudos file. So how do we select our honorees? Combining the DAISY Foundation's definition of extraordinary nursing care with our nursing professional practice model allowed us to develop and highly recommend that the site selection committees utilize this scoring guide. It helps us as an organization reinforce alignment with the professional practice model while guiding sites to look for extraordinary stories. We also align our Nurse of the Year and Nurse Leader of the Year awards with the professional practice model. Again, it's what nursing excellence is and how nurses do it within our organization. We still maintain that all sites give every nominee a nomination pin and recognize them for making a difference in a patient or visitor experience. We ask that DAISY coordinators align nominations monthly, providing almost real-time recognition. We recommend that sites choose the frequency of recognition based on site bed size. We recommend quarterly for small sites, which is 150 or less beds. Every other month for medium sites are 150 to 400 beds, and monthly for our large sites are 400 and above beds. We allow each site to determine what their Daisy celebration looks like. Some have reserved parking spots, display banners, and digital boards, various treats, and of course, the Daisy Award package. Quite a few of our sites have digital boards or televisions set up not only for our staff messaging, but also for patient messaging. We built a standard digital template for them to use to assist in celebrating their honoree. We also have a spot in our Nurse Forward electronic communication highlighting Daisy Award honorees. Daisy coordinators will continue to ensure that the honoree is listed on the Daisy Foundation honoree site as well.
One of the keys to success is the DAISY coordinator. And we encourage CNOs that they appoint their site's DAISY coordinator that is in close alignment with them, like their executive assistant. And a secondary backup is a member of their site's professional development council member. We then developed a DAISY coordinator committee, the DCC, that meets monthly, and we share best practices and ideas on various DAISY topics. We've also hosted open office hours for training and managing the program at their sites. And we host a Microsoft Teams site where they can access tip sheets and this resource guide that we developed to help them. We do what we have to do to ensure that that DAISY coordinator feels comfortable and confident in the technology and not overwhelmed by it. Since our go live on January 9th, 2023, we've had over 1,800 nominations come through our portal. So that's our journey. And we realize that through this first year, we will continue to improve.
But we are proud to say that we as an organization can offer consistent and meaningful recognition for nurses by nurses.